Hello everyone, welcome back to my YouTube channel, welcome back to another episode. You're joining me again on my way to work. It's a fairly well trodden path now into the hospital, and today I'm going to be talking to you about the things I wish I knew before I started life as a junior doctor. Up and down the country, thousands of medical students, final year medical students, are stepping up to become F1 doctors, first year doctors, in order to help us in the fight against the coronavirus. It's an incredibly brave thing to do. I just want to say how grateful I am, and everyone is across the NHS, for you all who are stepping up. You know, nurses as well who are graduating early and helping us on the front line. It will make a huge difference. As proud as I was graduating as a doctor, I must say it was pretty scary. You know, those weeks running up to starting on the wards were, ones I was pretty scared about, to be honest. And the thought of, that being brought forward and doing it sooner than you thought you were is kind of terrifying too. So I can only imagine how excited but also nervous you all must be. But again, you're going to make a huge difference. What I want to do today is give you some tips and advice that I kind of wish I knew that might help you on your first few days, weeks and months on the job. You're going to be absolutely fine. Together with some of these top tips, I hope they'll make a difference. Let's get started. So I'm just about to go inside now and get changed and ready for my shift, get started my day, and on my break I'm going to have a chat with Kath Taylor as well, who's going to help give some advice to you guys. Right, let's go in. Hey guys, so we've just taken a moment from our busy shifts to have a sit down and chat to you guys about some tips we'd give you if you are starting as an F1. It's going to be a difficult time ahead, but I think we've got to be positive and cheery. It's not going to be a depressing kind of chat. Let's be positive about this. We're going to give you some tips and advice that I think will probably help in your first days, weeks and months. And not only to doctors too, I think for nurses as well who are actually starting early. A lot of the principles we're going to talk about are going to be very similar. Let's start off talking about what your memories were of your first few days as a doctor.
I think I was quite anxious. I started on A&E, so it was very different to anything that we've done before. I'd obviously at medical school you kind of learn a lot, but then I don't feel like some of it prepares you actually for what the day job is like. So it's actually the stresses and managing both that stress and then a new place, because I was somewhere that I didn't know loads of people, I didn't have loads of my friends or family around.
How did you feel like on your first day?
I felt quite excited in a weird way, but I think as well because you've worked for so long to get to that point, so we've done sort of 5 years by that time. You kind of felt quite ready to start.
Yeah,
I think.
I agree. You feel like I'm ready.
Yeah.
I've done my med school bit. I'm ready to get going.
It was just sort of thrown a little bit into the deep end, but everyone was really friendly and really keen to help and things as well. So
yeah, and I remember for my first day, so I started my F1 job in King's College Hospital. I started on the medical ward, and my first day I was absolutely bricking it. There's no doubt about it. Turned up extra early. At like 7:30 when we were supposed to be there at 9 because I was really scared. I drank about 4 coffees, which didn't help.
No,
don't drink loads of coffees before your shift. That doesn't actually help even though we're sat here drinking it. But I was pretty nervous, pretty scared, but I must say I was very lucky and fortunate, because the first thing, and I would say, and the first kind of tip is to rely on the people around you in a sense. Don't be afraid to go, do you know what, I'm new, it's my first day. My name is Alex, whatever your name is, and introduce yourself to everyone and be like, I'm a new F1 on the ward. Do you think you could show me around? Can you do you mind if I ask you questions and tips? Because that's the first real big point. Is sometimes you think, oh, I graduate as a doctor, I need to know everything. You don't, do you? You
and you
don't.
won't know everything. I can guarantee you. So actually, and even now, I feel like us having done it for 5 years, you still ask questions, you still get help when you need it as well.
I ask questions
really
every day.
Yeah,
I ask questions every day. You ask your seniors, you ask your colleagues. Sometimes I'll be like, Kath, can you have a look at this? And what do you think about this? And we'll talk through cases. There's no shame in asking for advice or for help. I remember on my first day, I couldn't remember the dose of paracetamol. I was so nervous. So my first one, I was like, can I just check that this is the right, it's 1 gram every 6 hours. Is this right? Yeah. Do I write my name in this box? Don't die. No, it's fine. So we'll continue now that we're back and the phone is back safely mounted. So I was really nervous, and I felt really afraid of asking people, can you just kind of confirm this is right, because you think I should know this. But there's no shame at all, is there?
No, I think as well, it's quite important to download apps, which I use quite a lot. So like BNF and things, you don't have to go rooting through a big book now. You can just have it there, because particularly on those first few weeks, and even now, I think I still probably check doses most of the time. You're trying to remember so much, and just remembering numbers and stuff is like a little bit too much, and you don't. The main thing is that you just don't want to make a mistake on.
Yeah, absolutely. So don't be afraid to look things up. The apps that I would say to download, first of all, Induction is a really brilliant app. So Induction, you put your hospital in. It's got basically every hospital in the UK, and it tells you all the numbers, all the bleeps of everyone you need to know. Like what the medical registrar's bleep is. It tells you what the radiology number is, which you need to know, and it's just in the app. It makes your life easier. Download the BNF as well, because you can look up doses, check stuff. I still double check doses I prescribe all the time. If I haven't prescribed a drug for a couple of weeks, I just check that it's the right dose. It's absolutely fine to do that. So make sure you download the apps that are kind of useful. The other ones that people sometimes download are like the Oxford Handbook in the app if you want to do that. But for me, to be honest, like the main ones I use are the BNF, the Induction app. Anything else?
I think I used to carry around my Oxford Handbook.
Oh, you're one of those,
in my bag.
Yeah. And I see some people like to do the whole.
I think it was just there as like a comfort thing.
She's got her little books running around A&E just to check.
Okay.
But some people do. I see people have the clipboard things, and if it's useful to you, so some F1s get like a clipboard that you open up and you have like the notes in there, and you can keep your book in there. If that's useful to you, then do it. There's absolutely no shame in that at all. I know people have done that. For me personally, I lose everything, and so the minimum stuff that I carry, the best. So I have my pen, I have my phone, which I have my apps on, and usually I have a coffee when I need it.
I lose my pen every single shift. I still do that.
That's another top tip. Don't buy an expensive pen, because you always have, every now and then you have an F1 who comes in with a lovely pen. I'm like, I respect that pen, but that's going to be gone.
Keep it for home.
It's either going to be lost, or I'll probably end up borrowing it from you and forgetting and taking it home. So a couple of important tips there then is that don't be afraid to ask for help. There's no fear in that at all. And actually, particularly going back to that a little bit, you know, if you are worried about a patient, you think this patient could be unwell, I'm worried about the observations, think they're sick, then call for help. Call your senior house officer, your more senior doctor, or your registrar, and get advice, right?
Get your seniors involved early if you're worried about anyone, because they want to know if you're worried about patients as well.
Definitely. And I think people sometimes are a bit worried that I don't want to ask for help, I might look like I'm stupid, or they might get angry. At the end of the day, your responsibility is to do your best for the patient, and if that means you need to ask for help, then don't be afraid or ashamed of doing that. And actually, not that, and I think it's very rare these days that people are rude if you ask for help. I actually very rarely experience that, you know, myself. You know, sometimes you meet people who are a bit grumpy and had a long day or whatever, but most of the time everyone wants to help you. And actually, if they're rude to you and they throw it back in your face that you've asked for help, that is a more reflection of them than you. I promise you that. I absolutely promise you that. Do not be ashamed of asking for help. Meeting, I think colleagues is a good point. Making friends, because often when you go to different parts of the country, I came to King's, I've never been in London before. I felt very, very, very alone. I actually broke up with my girlfriend recently before, so I was pretty depressed as well. Crying in the corner. So making friends is very important to me, and making a little WhatsApp group with other F1s you can ask help as well.
Yeah, definitely. I think we had tried to get regular socials in, and just having even if it's just going for a coffee with people at like lunch, or getting off the ward for 20 minutes, half an hour, I think that gives you that break as well, to have sort of time to speak to people and actually make friends at work, because they're the people that are going to understand what you're kind of going through. Definitely. They're all in the same boat as you, particularly as F1s, where you've not done this before. No. It's all new.
It's all new to all of you, and that's a nice, that sense of like common, we're in the same situation, the same boat together, actually is hugely, it's a very powerful thing. And I remember like the bond I made with some of the F1 friends that I made is really, really strong, because you go through something together. And especially at the moment, clearly you can't go out to the pub, you know, at the end of the week and have a couple of drinks and all that kind of stuff. You have to find different ways to, you know, kind of communicate. So make a WhatsApp group, get yourself an F1's WhatsApp group. You can all chat in there. You can put kind of common questions like, you know, where do I find the radiology room? You can put all those kind of common questions in and develop a bit of friendship. And of course, you know, if you're working on the ward with people, you know, social distancing allowed, you can kind of at least have a coffee and a chat with them on the wards as well. So do make sure you try and make your friends and your bonds and stuff. It's really, really important.
Also making sure that your mental health is really good. Change of becoming a doctor and also starting in coronavirus, obviously it's going to be stressful, and it's in a very alien situation for all of us, and then actually to be starting a new job with new colleagues, possibly in a new place as well. It's really important to make sure that you keep some sort of routine, so trying to do things like regular exercise, eating quite healthily as well, making sure you do eat. Don't go to work without having breakfast, because when you end up on a 5-hour ward around, you will be upset that you've not eaten.
And might feel lightheaded and stuff like that.
And you probably will feel pain. That's what I would feel.
Yeah, there's a lot of people that I know that didn't eat breakfast because they're very nervous. And it's understandable if you're nervous not to, but trying to make sure, like you said, try and bring some food, some snacks that you can eat during the day. Hopefully you'll have time to go for lunch, and you should make time for lunch. It's really important. But just make sure you've got stuff, basic stuff that can keep you going, give you energy. Because some people actually don't eat during the whole shift, and I think, well, how you can't sustain that. Can't sustain it.
No.
This is a staff announcement. We will be testing the emergency buzzers in majors. Please do not respond.
So just making sure you're looking after yourself, exercising well, eating well. Oh, there's the buzzer. There's an emergency perhaps one. Now, if you hear that buzzer, it does mean that there's usually a problem. But listen out that there's a test, because often they do test it rather than that. But you've just heard what the buzzer sounds like. Eventually, the buzzers will stop. We'll just carry on anyway, and you can just get a taste of the environment, what's happening. Looking after your mental health is super important. Exercise, sleep, diet, speaking to your family and friends, talk to your colleagues, but also your family. They're there to help you. I spoke to my mum and dad almost every night about the things I was experiencing, and that did help me. It did help me.
I think as well, having that sort of someone to talk to, I think it's really important as well. Like, don't go home and be like, just sort of mull over the day as well, because you will see things that are difficult to watch, and realistically it's not a reflection that you're a bad doctor. Just make sure that you do speak to sort of family and friends and things as well, just for support, because they're all there, they all care for you, and they want you, obviously you've been training for ages to do this, they want to support you with that.
Yeah,
well.
And I think that you raise a good point there. It's natural to be upset by some of the things we see. I still get upset by stuff I've seen, particularly in the last few weeks and months, and that is completely normal. So don't be afraid to tell people about how you feel. And I think we'll come on to our last point now, and this is a very, very important one, maybe the most important one.
The key.
Make sure you work closely with your nurses from day one, because my first day on the ward, I was like, I don't know what I'm doing, I haven't got a clue, I'm terrified, help me, and the nurses were absolutely amazing.
Yeah, they have usually done the job for longer than some of the doctors there. They know where everything is, they literally help. Even now, they are just amazing.
They've got a lot of knowledge, got a lot of experience. Work closely with them.
Don't annoy them. Don't be rude to them. We're all under pressure and things. But just be work as closely as you can with them.
Work closely with them, and buy them a coffee every now and then. That does help.
Yeah, it always helps.
I hope it's been useful. Thank you to Dr. Kath again for joining me. You're very popular on the channel now, as giving your advice and stuff. So thank you. Good luck to everyone who's starting. I think you're all amazing. All the doctors and nurses up and down the country are stepping forward to kind of help on the front line. It's something that's not easy to do, and doing it before you were kind of expecting to mentally is difficult as well. Yeah. But you'll be absolutely fine. And to anyone who's starting at Lewisham Hospital and you need to ask for any help or advice about anything, ask one of us.
Yeah, we're
very happy to help. So thank you to everyone. I hope the video has been useful. Please do comment, subscribe, do all those bits and pieces, and also put any questions down below. Anything we haven't kind of picked up in this video, I'll try and answer in the comments. So write it down below. From both of us, goodbye and take care.
Good luck, guys.
Bye-bye.
Bye.